Hello, I'm Dr. Asuman Çelikbilek. Today I am going to talk about the effects of epilepsy on the patient's quality of life. Epilepsy is one of the most common chronic neurological diseases in the society. As with all other chronic diseases, epilepsy can seriously harm a patient's welfare. Even simple interactions like forming a family, continuing their job if applicable, completing their education, and getting a driver's license can pose a significant challenge for epileptic patients. Research suggests that individuals with epilepsy are more prone to psychosocial disorders compared to a normal individual by roughly 30%. Besides this, unless specifically asked, epileptic patients do not state their disorder, causing the disorder to be neglected or not treated. The most common psychiatric disorder in epilepsy patients is depression. The patient can experience some difficulties since the diagnosis of the disease to accept their disorder and get used to the long treatment period. Chronic disease psychology can also impose a more pessimistic outlook on life. Additionally, the feeling of getting flagged as an epileptic individual can also arise the problem of social isolation, thus causing depression. Especially with temporal lobe epilepsies, symptoms of depression are more common. Properly identifying depression and preventing self-harm is crucial for this reason. The second most common psychiatric disorder we see in epilepsy patients is anxiety, which is a state of nervousness and unease. The fact that the attacks can repeat and it is unclear when or where it may happen, whether they will lose consciousness and whether the attack can be taken under control, creates uncertainty and fear in the patient, and if the case is excessive, can cause a panic attack. This can be misinterpreted as an epileptic seizure and can make the diagnosis more challenging. Therefore, it's vital to hold psychiatric meetings with patients diagnosed with epilepsy in case of depression, anxiety, or other underlying psychological disorders. Suggested psychosocial rehabilitation for epilepsy patients consists of three stages. First stage is consultancy therapy. The aim is to make the patient accept their disorder. The patient is trained to deal with his or her disorder, therefore teaching the patient to be more positive with regards to their disorder. This method ensures the minimization of depression or anxiety to a substantially lower level. Second stage is social support. Social support programs are constructed through the phone or face-to-face social sharing networks. Socialization of the individual is achieved in this step. Third stage is education support. Individual is educated with regular, planned, and accessible education programs and taught how to manage their seizure. It's important to note that traditional medication treatment is not sufficient for diagnosed epilepsy patients. If there are any accompanying psychosocial problems, only the early diagnosis and simultaneous treatment of the disorder can provide the optimal wellness condition and thus improve the quality of life of the patient.